SELLAS Life Sciences Group, or ticker symbol SLS, just had some significant data come in for their phase 3 REGAL trial. In today's video, we're going to be highlighting why I think ticker symbol SLS could be a pretty strong buy for those of you that like to have a little bit of an angel investing, penny stock investing portfolio as a part of your big portfolio. But I think, again, some of the things that we saw with the GPS therapy for amyloid leukemia, or AML, are actually pretty substantial, especially when we look at remission rates with their new drug. Now, remember, as always, never financial advice, just trying to put you guys on the plays that I'm in. If you're new around here, smash the like button and also consider subscribing to the channel if you find the information useful. It's been amazing. We just hit 100 subscribers, so thank you to each and every one of you that have taken a chance on this journey. And let's go ahead and dive right in. So, ticker symbol SLS, SELLAS Life Sciences Group, is actually up about 35% in the last 5 days. It's up 119% in the past month. And if we look at the year to date, also up about 208% after good data throughout quarter after quarter has been announced or released from their current REGAL trial. Now, remember, the current valuation of SLS is right around $477 million. I personally have not established a position yet because of the run-up that it had over the last 5 days. I'm waiting for it to cool off a little bit and try to get in somewhere between this $2.68 range to maybe even up to $3. I think right now you might be buying it at a premium because we are expecting some data release in the coming weeks, Q1 2026, even in the month of January. But let's go ahead and dive in and talk about why it's had such a strong price action. So, SELLAS Life Sciences provides update on pivotal phase 3 REGAL trial for galectin, which is just going to be called for the rest of the video GPS in acute myeloid leukemia, or AML. Now, it says here, contract research organization for REGAL trial has informed the company that 72 events have occurred in the trial as of December 26, 2025. SELLAS remained blinded to the trial outcomes. So what's really good is, again, they're following the gold standard with the blinding of this trial and the randomized control trials, or RCTs, which are the gold standard, as you guys know. Again, I've mentioned in a previous video, my name is Ahmed, and of course, I am a pharmacist by practice. So again, something I really do enjoy and have been doing for quite some time is looking at different things within the biotech, biopharma, and even just regular tech industries. And sometimes I like to dabble a little bit of my portfolio into angel investing in early seed rounds and also even in early stock market plays like SLS. Timing for the final analysis is event driven, and SELLAS will announce the occurrence of the 80th event. So, it's a late stage clinical biopharmaceutical company, for those of you that aren't aware, focused on the development of novel therapies for broad range of cancer indications. Today, they provided an update on the ongoing phase 3 REGAL trial evaluating GPS as a potential maintenance therapy in patients with AML after second complete remission, or CR2. Let's take a pause there for just a second. So when you hear CR2, complete remission 2, that means they've already had AML, they had full remission once before, meaning there's no signs via scans, blood work, or basically all the testing available to the healthcare system showing that they are completely cancer free. Once you are in remission, sometimes the cancer can come back. And so what they saw with GPS, it's potentially a maintenance therapy for people that are with AML after a second complete remission. That means they cleared the cancer the first time, they got it back, now they're put on this GPS therapy for maintenance therapy, getting a second complete remission. Following the independent data monitoring committee recommendations from back in August to just continue the trial, because remember, there was some things that came up back then in terms of modification potential because of just side effect profiles and things of that nature. But it was expected that the 80th event, death required to trigger the final analysis, would occur before year end. The REGAL trial is an overall survival study, and per the statistical analysis plan, the final analysis will be triggered once 80 events, deaths, have occurred. And to this point, it has not happened. SELLAS was informed by its contract research organization managing the REGAL trial that the pooled number of events was 72 as of December 26, 2025. SELLAS remains blinded to all efficacy and survival data outcomes, and as No outcome analysis were performed and no statistical penalty has been incurred. The one-time update on the aggregate number of events does not impact future statistical analysis. Okay? Because the final analysis is event-driven, the timing of the studies with the overall survival endpoint can vary. Cells will announce the 80th event when this occurs. Stock surged today after market opening over the last 5 days and even month because of obvious reasons. If the 80th event didn't occur and they were not told to stop the trial from all-cause mortality during this REGAL trial, that means that things are going better than expectations in terms of survivability. So with that being said, one of the things that was commented about was we appreciate the continued dedication of the patients, families, and investigators participating in the pivotal phase 3 REGAL trial where survival times, fortunately for patients and caregivers, appear longer than expected, as I just mentioned. This is from Angolis, which is the MD and the President Chief Executive Officer at Cellus Biopharma. While the 80th event has not yet occurred, we remain fully blinded. Every passing month may increase the probability of success study as highlighted by key opinion leaders or KOLs in recent R&D events. So again, SLS and biopharmaceutical companies, their valuation is not only based off of the data that's given via phase 3 clinical trials, even if certain data is expected, right? Because we look at price to earnings and things like that when it comes to the general stock market. But when you look at early stage biopharmaceutical companies, what you need to make sure you're paying attention to is when you have favorable outcomes occurring during a phase 3 clinical trial. And right now, for SLS and their GPS therapy for second complete remission patients, is the fact that they have not reached this 80th event, that is death. So people are living longer than expectations. And with that being said, now the stock has potential to maybe even complete their phase 3 clinical trial, go in and get complete regulatory approval through the FDA, which then leads to the PDUFA. And from there, you see the medication rolling out to the masses, which in turn turns it from a micro cap or even mid cap at a $500 million valuation today to a multi-billion dollar company with a revenue generating product. So in addition to that, sometimes what we see in biopharmaceutical companies that have successful medications or drugs on their pipeline, we see acquisitions from bigger pharma companies. And so for your shares, that's usually a very good thing. Now, again, one of the things I need to make sure I highlight is you're still entering the speculative stage because you're, again, hoping that good data comes. So if you're someone that appreciates the science or someone that really wants to see this thing through and through, for whatever reason that might be, whether you're someone that's just interested from a financial sense or also from a science sense or a combination of the two, this could be a pretty interesting buy going into the end of 2025 and going into 2026. First one I've talked about on the channel, and we'll see. I want to see the feedback down in the comment section below of what you think about some of these biopharmaceutical companies. But I think Cellus right now shows a pretty strong buy based off the data that is being released. And hopefully we're going to see better financials. Right now we're seeing quarter 3 2025, 4% year over year growth at negative $6.79 million. Because remember, they're still looking to roll out their big and heavy hitters. I appreciate you guys so much. That's all I have for you guys today. And until next time, as always, everybody, keep investing. Peace.